doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
WOR, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we have Joyce on the line. Good evening, Joyce.
Good evening, sir.
How are you tonight?
Fine.
Great. What's your question tonight, Joyce?
I was told last year by doctors that I am getting blood cancer again.
I'm sorry to hear that.
That's all right. I had it before. But I'm Navajo. I use herbs, and I did herbs before, and it worked out like 20 years ago. But I have two questions. I hope I can. The other thing is that as an American Indian, I am dangerously allergic to any kind of radioactive iodine. And I think that I just need your help.
Well, why don't you give us a call during the week at 212-CHOICES. Call me directly, and we can spend some time and go over your case in detail and look at the pathology and records and then give you the best possible advice.
That sounds excellent.
Okay, so give us a call during the week. Thank you, and God bless you, Joyce. We had a gentleman come in this week, 69 years old, black man with 6 children, for a Gleason 7 cancer. He had a PSA. The PSA is prostatic-specific antigen, like many men are getting nowadays. It was elevated at 9.5. He had a Gleason 7 cancer. We're going to take this call. Good evening. You're on the radio.
Hi. I'm not calling for myself. I'm calling for a nurse that has a husband who has pancreatic cancer.
I'm sorry to hear that.
I told her about Dr. Gil Lederman, and she will not take a chance. I was wondering if you could send me literature that I can give to her so she could perhaps.
We're happy to send. We're happy to send that. We're happy to send it. Just call us after the show at the same number, 212-CHOICES, either tonight after the show or during the week after the show. And at no charge, we'll send a booklet and a DVD about our work for pancreas cancer. We were the first to use radiosurgery to treat pancreas cancer, either in the pancreas or the liver or metastatic sites. Our success rate where we aim the beam for pancreas cancer is about 94%, so it's quite high. It's non-invasive treatment. There's no cutting, no bleeding. A treatment takes about 15 minutes. So please give us a call. We'll send you information. And
I told her about it. I told her, because I hear your program all the time.
Okay, thank you.
I told her about it, but she'll not listen to me.
All right. Well, we're happy to try, okay? We'll do the best to try.
Okay, I'll give it a try. So if I can, when can I call you?
Anytime other than the radio show, and I'll get your address, because I just don't want your address to be broadcast on the radio. Okay?
Yes.
Thank you. God bless you, and good night. Bye now. So this gentleman came to us with a Gleason 7 cancer. Remember, he had a PSA 9.5. He's sexually active, fully functional, working man, and he wants to stay that way. He came to us. We talked about all the options, and he chose because of the data, and we believe that the data is so critical. We showed him the data from multiple centers in New York and Baltimore and Boston and Philadelphia with surgery for Gleason 7, his success rate would be about 60%, number one. Number two, most likely his sex life and urinary life would not be the same. He'd have the big operation. Compared to us, the beams come in, hit the prostate. We then put a few seeds in the prostate directly through the skin, not touching the penis, the scrotum, the anus, or the rectum. Takes about 45 minutes. It allows us to boost the dose to the prostate safely. And with us, and we've treated about 3,000 men with prostate cancer, our data shows about a 90% success rate compared to 60% with radical surgery and a better quality of life. So 50% better, avoiding radical surgery, the hospitalization. He decided to start treatment, and that's where he is today. Starting treatment, most likely he's going to do great. So we wish him well, and we'll do everything we can to make sure that he is A-OK. We got another call today from California, and it's a sad call, really. A woman called about her husband. Her husband's 30 years old. He lost some hearing and balance. He went to a big hospital in California. They diagnosed him with an acoustic neuroma, which is a benign tumor. It's a benign tumor of the hearing nerve, the 8th cranial nerve. They told him it was urgent that he have surgery. They have a brain tumor. They have urgent that he have surgery the next day. He agreed. He didn't know better. He didn't get a second opinion. He had surgery the next day, which was 6 months ago, and he was left deaf. He was left with facial paralysis. He was left with residual tumor. And now, 6 months later, he still has the deafness, which will never go away. That's a permanent deafness on that side, which means he's lost his stereo hearing. His facial paralysis means he can't move his eye and his mouth. When he has some soup or a drink, it comes out of his mouth. So it's a big social issue and a functional issue. And now the residual tumor is growing. So really, the treatment didn't do him good, caused a lot of harm. He's 30 years old with a young family, and he found out about us, another patient who came from California recently for acoustic neuroma treatment, who's a pilot for one of the major airlines, doing great after treatment, told him about us. So he's very interested in coming for acoustic neuroma treatment. We have the largest experience in the world treating acoustic neuromas, which are these benign tumors that affect hearing and balance in the head. This 30-year-old man is going to send out his films and records so we can review them, and we'll get back to him. But the point for all of us is sometimes you need to hold back, take a breath, and get a fresh second opinion, which is a recurring theme tonight. It's a recurring theme always, because for this man, it would have changed, most likely, his life for the rest of his life and that of his family. On the good news department, we had a man who came in. We treated 2.5 years ago for prostate cancer. He's a 40-year-old trainer, so he's in great shape with big muscles and a six-pack. His PSA was 9 back then, and 6 months ago it was 0.23. And he gave me a call. He's really worried. His PSA went up to 0.8. And I said, well, were you doing anything different? And he said, yeah, I had sex the night before. And I said, well, sex can raise your PSA and could even be a laboratory error. So let's repeat that. So remember, his PSA was 9. He got treatment. PSA fell to 0.23, went up to 0.8 a day after sex. We repeated it, and it's back at 0.2. He's in remission, doing great. And he is happy. He's very happy. So there was a news article in the Washington Post, and a lot of people are talking about this news article because it reflects a possible conflict of interest between big hospitals and the pharmaceutical industry. And a lot of patients come to me and say, well, Dr. Lederman, if you're so great, why don't my chemo doctor recommend radiosurgery? Well, listen to this article. It was published in Washington Post, April 1st, written by the Associated Press, and it starts out saying, leaders of many U.S. academic medical centers sit on the boards of some of the world's biggest drug companies. which a study suggests raises the potential for worrisome conflict of interest. Now remember, the industry board members oversee company decisions and have a financial responsibility to the company's shareholders. These duties, they write, could compromise decisions the medical center leaders make that affect patient care, education, or research. In 2012, they found that 16 of the 17 largest pharmaceutical companies had at least one board member who held leadership positions at one of the 30 academic medical centers. They included CEOs of the medical centers, medical school deans, hospital directors, trustees, and clinical department chiefs. And how much were these people paid to attend a few meetings a year? From $100,000 to $500,000 to attend a few meetings for the drug companies. And their primary responsibility was, you would think it would be for you, the patient. Wow. Wow, oh wow. It raises the question of conflict of interest. This was reported Tuesday in the Journal of the American Medical Association, so a very prestigious journal. How did they get all this data? Because how would you find out if Dr. X is on a board? Well, they collected the data from company websites, proxy statements, shareholder reports, and from the United States Securities and Exchange Commission's public database. Wow. So when you ask me, why didn't my doctor recommend radiosurgery? Was it because he knew about it or didn't know about it? Or maybe there was a bias. Maybe there was a bias. It's something to think about. The beautiful thing about a private cancer treatment center like us is we work for the patient. We're there for you. We don't get supported by the drug company or the surgeon or the urologist. We do the best we can for you, which is very different than most big hospitals and cancer centers. So you may want to think about that before you decide where you're going to get your treatment. Who do you want to take care of you? Someone devoted to you or someone who might be receiving money from a drug company? And another report in the New York Times talking about hospitals. How many hospital infections do you think there are a year in the United States? Well, if you guessed 722,000, nearly a million, you'd be right. About 1 in every 25 patients in the hospital gets an infection while they're in the hospital. They're not going to the hospital for infection. They're going for another reason, and they get an infection. And of these 720,000 patients, 75,000 of them died. So about 1 in 9 people who go to the hospital who get an infection die with that infection. Where was this reported? In New England Journal of Medicine, which is probably the world's most prestigious journal. So again, when you can stay out of a hospital, it's probably a great idea to stay out of the hospital. Hospitals are not the world's safest place. Maybe they're great for certain things, but maybe they're not great for other things. We're going to hear from 2 new voices now. We're taking your calls at 1-800-321-0710, 1-800-321-0710, and we'll be back in just a couple of moments.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique.